So Farai, if you don't mind, we'll jump straight into this. I have a series of questions I'm going to ask you. But if we can start with you just introducing yourself and then telling us about your solution to fighting coronavirus. That would be great.
Okay, awesome. So first of all, thank you for having me on board. Pleasure to meet you. Excited to talk about this. So my name is Farai Chikumbu. I'm the co-founder and CTO of Epione.net, which we founded in 2017. So briefly, Epione.net as a whole, we aim to address the fragmentation of the health systems in African countries by providing an end-to-end healthcare platform that integrates all critical elements of the patient journey. So being your patient, your provider, producers, and funders as pairs. From a COVID-19 perspective, we are all seeing the ineffective screening, channeling, tracking, tracing. All of that is posing a great challenge on the continent, leading to a lot of fragmented care and health outcomes. What we have done in top of our current capability is we have, using our web-based and a mobile application, we enable individuals and healthcare practitioners to conduct remote screening, tracking, tracing, monitoring, and processing of suspected and confirmed COVID-19 cases. On top of that, we allow doctors to use the platform to monitor symptoms logged by their patients, conduct remote billable consultations, and also further refer those patients to testing centers within the country.
Excellent, excellent. No, really appreciate that summary. Could you give me a bit of an idea of how your sector, as well as your company, has actually been affected by COVID-19?
Okay. From our sector, and I'm going to drill down a little bit to say from an EHealth, I'm going to say like EHealth perspective, we're seeing a lot of increase on telehealth consultations, a lot of demand on that, a lot of demand on electronic prescription of medication, and also doctors also trying to, previously you would have seen doctors very apprehensive in using technology to do consultations, but now they are approaching us saying, I need this urgently. So they're trying to, practice health and safety just as much as we are and still conduct their jobs. Just drilling down further from a company perspective is it's impacted us in a positive way. We are fortunate that we are a young and agile company, and with the introduction of our COVID-19 screening capability, it has helped to drive significant growth in registered users and active users across both doctors and patients. And then obviously now with the transition back to the workplace, with the lockdown restrictions easing, another positive impact for us has been we are allowing corporates and governments to do mass screening for the employees and link that to clinicians, team leaders, occupational health and safety team leaders. And the positive thing for governments is that they can use that real-time data to track and trace COVID-19 cases, thereby identifying potential COVID-19 hotspots, and governments can make better informed decisions that impact the health systems in a better way in terms of alleviating pressure. And it also ensures that resources are focused on symptomatic patients, assisting patients to effectively assisting patients in effectively assessing, testing, and care, and also providing real-time data for disease management.
Interesting, interesting.
Yeah.
I mean, you've mentioned a lot around the technologies that the government's been using, et cetera, and data, et cetera. In your opinion, is digital technology one of the main weapons that we can use within the African context against COVID-19?
Absolutely, without a doubt. As the virus is spreading across the continent, measures to combat the pandemic, such as social distancing and quarantines, are shifting attention towards technological solutions. And responding to the pandemic has required a lot of collaborations and sharing of information across different technologies, and also different stakeholders. As such, the lack of an end-to-end patient care coordination on our side and management system during this crisis further exacerbates the information gaps, the inefficiencies, and drives costs. So it definitely is the opportunity for digital technology to come to the fore and positively make a difference in this fight against COVID. And also adding on to that, from our perspective, knowing that existing systems are ill-equipped to manage the virus due to the fragmentation, we felt we were well positioned to support COVID-19 by enhancing our platform because it's already digital.
Yeah.
And unlike other solutions, we already have that entire value chain connected.
Fantastic. No, I really appreciate that. I really appreciate that. So, obviously lots of business leaders and entrepreneurs are looking at, or will be looking at this information. What do you think are the economic lessons that can be drawn by these individuals from this crisis? So from business leaders and entrepreneurs?
Yeah. I think that's a very good question. I thought that's a very good question, but it immediately hit. Two things immediately came to the fore for me, and I think there are many lessons that can be taken out of it. But for me, two things come to the fore. Being in the healthcare space, healthcare is something that I'm passionate about. But something that I'm seeing is a lot of people are making healthcare now. It's more apparent that it's a very precious commodity. You can't mess around with health. It's what we have if you want to have a healthy life and live with our families and friends. So I think there's what I'm seeing is more attention to that, and I think there's more attention to our current health systems across the globe to make them more stronger, making them more accessible, making them less expensive. And because, for example, one worrying stat for me is, there are 1.3 billion people on the continent, and we've got about 8,000 to 10,000 ICU beds. That's very worrying, considering that there are 400 million people in Nigeria, Ethiopia, and Egypt. And between those three countries, there are 2,000 ICU beds. And you just wonder what the other countries have. And you've got South Africa that's got 4. And you're spreading that across the country. I feel like there's so much opportunity to grow our health systems and make an impact for those who can afford it, and also those who barely can afford it. I think there's space for that.
Yeah. Sorry, no, go ahead.
Oh, sorry. And the second one I want to mention is digital access. I think digital access is like a commodity. It's like, utility, like electricity and water. We're seeing an increase of telehealth, and that applies to many more industries than healthcare. It is part of how every industry will be transformed as the pandemic hastens the digitalization of work in every sector. So much of how we lead into the future will be digital, I believe. And because of the work on the front lines in healthcare, I believe there are lessons for all industries in that respect. So there is a need to ask ourselves, how can we make our services more digital for the greater good of our people?
No, it makes sense. No, I appreciate that. The comment I was going to make was, when we looked at the stats, it's just there needs to be some really big shifts in reallocation of budgets, more to healthcare and digitization and things like that. Look, Farai, I would love to talk so much more, and we definitely have to stay in touch. But then the last few things here. So as you know, this will be going out to quite a number of people, including investors and governments, etc. What would be your elevator pitch for that? And then for your own profile, if you could just give us a few words, also mentioning INFORAFRICA at the end. So first the elevator pitch, and then the statement with INFORAFRICA. That would be great for us.
Okay, awesome. So the call to the investors and governments is Epione.net is a solution that addresses the current siloed approach to patient care and information. The absence to end-to-end patient care coordination and management system translates into fragmented care, escalating costs, and contributes to poor health outcomes, resulting in inefficiencies, compromised quality, and escalating costs. We bring to market a patient-centric, end-to-end collaborative platform for all health stakeholders, patients, providers, producers, and payers, with our platform, which is with our core capability and COVID-19 offering, which is truly universal with the potential to positively impact millions of lives. We are starting our fundraising round next month, and we welcome potential investors and governments to engage us and create long-lasting relationships. Thank you for INFORAFRICA for this opportunity. We're looking forward to more information that you can share with us. #INFORAFRICA.
I'm in for Africa. I'm in it for Africa.
I'm in for Africa.
I am in for Africa.
I'm in for Africa.
I am in for Africa.
I am in for Africa.
I am in for Africa.